As from the 18th of May, inpatient services will transfer from the county hospital to the Royal Stoke Hospital. That means if your child, baby or young teenager needs a hospital admission and to stay in the ward for a short stay or a long stay, that will happen here at the Children's Centre at the Royal Stoke Hospital. We will also continue to have an array of services at the county site which you'll be able to access.
So we're really hopeful that we're going to be able to improve the care in terms of the facilities and the availability of specialists for lots of the children who live in Stafford who currently have to go to regional centres for some of their specialist care, and we will be able to provide that here much closer to home. Here we are a centre of excellence for many specialities, so we now have an on-call respiratory team that covers 24/7. We're able to get opinions from them, and we're rapidly expanding our gastroenterology team. We do a lot of oncology work, more than some of the smaller tertiary centres, that's the cancer care. And we have a specialist intensive care and neonatal intensive care as well.
This is Ward 216. It's one of the children's wards here at the Royal Stoke Hospital Children's Centre. This is probably a very good example of one of the wards your child might come onto if you're admitted to the hospital. We admit children with medical conditions, children who may need day surgery or longer stay surgery. We have a play team who will entertain your children. We have 24-hour open access for all parents to come and stay with their children. We also provide pull-out beds by the side of the children so that the parents can sleep actually on the wards with them. And we also have a parents' accommodation unit that has an ensuite bathrooms in all the rooms with a separate kitchen and sitting area for the parents to have access to.
Families from Stafford will have to travel a little further to come here, and we understand that, but we had already been pushing to try and develop parent accommodation because we feel that even when families live close by, it's useful to have a base that is off the ward area for parents to sit and have some downtime to prepare food, which will massively improve the situation for families travelling from Stafford. And seeing the benefit from having such wonderful new ultra-modern world-class facilities, and I'm sure that the Stafford parents will feel the same once they're able to come here and see it.
From the 18th of May, we're going to have a new area at the county site. The new area will be called the Children's Emergency Centre, and it will incorporate assessment beds, children's emergency care, and also what we're going to have as a new service, the rapid access clinics. If you've got an unwell child, baby or young adult, the first point of call would be your general practitioner during working day hours. Your general practitioner would then refer to the children's assessment beds in this new area at the county hospital. The new service called the rapid access clinic allows your general practitioner, if he's got a concern or a worry, feels he needs further guidance and help in the management of your child, your baby or your teenager, will again refer to this clinic. It means that you can get an appointment the next day. The children's assessment beds are also in this area, and again this means if you visited your GP or you've been to the out of hours service and they have a concern and feel they need immediate support, they can refer you and your child, baby or young teenager to this area. Equally, as parents, there's times at out of hours when your GP isn't available that you need some help because your child is unwell and you need that support immediately. And again, you'll be able to access the Children's Emergency Department that sits within this area. The Children's Outpatients Department at County will remain at its current location. Going forward, we're going to increase some of the services at the county site in the outpatient department. And that could mean for you, if you've got a child that currently accesses Birmingham for cardiology, that those clinics will be done jointly at the county site. There'll be increased speciality clinics for respiratory and gastroenterology.
And when you're in the position we were in, we would have gone to the moon. I don't think distance is an issue. when your little one, I mean Rosie's only 2 weeks old, so distance is nothing really. And in terms of longevity, I mean we're nearly a week here now, but it doesn't feel like it. We were given fabulous level of care when we got here in the intensive care ward, phenomenal, second to none. We even were given a room, my wife and I were given a room, which was our own room. We had a key. Everything was thought of for us in terms of shampoo, shower gel, even the small things count.
And of course we're very excited that we're going to be gaining an additional brand new ward that's going to be specced out to the high specification. This is a 28 bedded ward facility, and obviously that will allow for those patients that would have been seen at the Shrubbery ward at County who will now be seen here at the Royal Stoke Children's Centre.